Good morning, my name's Dr. Jeremy McAnulty from New South Wales Health. I'm here with a COVID update for New South Wales for Tuesday the 30th of November 2021. There were 179 cases of COVID reported in New South Wales through to the 24 hours through to 8 o'clock last night. In the same period, there were more than 62,000 tests reported. In terms of hospitalisations, there are 160 people with COVID admitted to hospitals in New South Wales, 26 people in intensive care, 11 of whom require ventilation. Sadly, we're reporting the deaths of 3 people with COVID today. A man in his 50s from Tamworth died at Tamworth Base Hospital. He'd received 1 dose of COVID vaccine and had underlying health conditions. A woman in her 60s from southeastern Sydney died at St Vincent's Hospital. She had received 1 dose of COVID vaccine and had underlying health conditions. And a man in his 40s from Western Sydney who died at Nepean Hospital. He'd also received 1 dose of COVID vaccine and had underlying health conditions. We'd like to extend our sincere condolences to the families and loved ones of these 3 people who have sadly died. In terms of vaccination, across New South Wales, now 94.5% of people aged 16 years and over have received 1 dose of COVID vaccine, and 92.4% have received 2 doses. Of the people aged 12 to 15 years, 81.2% have received 1 dose and 76.5% have received 2 doses. As announced yesterday afternoon, genomic testing has confirmed that 2 more overseas travellers have been infected with the Omicron COVID-19 variant of concern, and they're included in today's numbers. The total number of confirmed cases of Omicron is now 4 in New South Wales. Both passengers arrived in Sydney from Southern Africa on Singapore Airlines flight SQ211 on Sunday the 28th of November. They were fully vaccinated and isolating in special health accommodation. Everyone on the flight is considered a close contact and will need to get tested immediately for COVID-19 and isolate for 14 days since they were overseas, regardless of their vaccination status. New South Wales Health is contacting all passengers and flight crew to advise them of the isolation requirements, and they can call New South Wales Health on 1800 943 553 for further advice. New South Wales Health is investigating 2 COVID cases who arrived in New South Wales on flight QR908 on the 25th of November. Both cases are isolating at their respective homes. Urgent genomic testing is underway to determine whether these cases have been infected with the Omicron variant. All passengers on this flight must be tested immediately, regardless of previous test results and vaccination status, and isolate at least until they get a negative result. Another international traveller who is isolating at their home in Sydney after arriving on a flight from Southern Africa on Tuesday the 23rd of November has tested positive for the Delta variant. This person had travelled to Melbourne on flight VA 800, departing 6 a.m. on Thursday the 25th of November, and they returned to Sydney on flight QF 486, which departed Melbourne at 7 p.m. that evening. Passengers in the surrounding seats on the VA 800 from Melbourne to Sydney have been deemed close contacts, and all other passengers and aircrew are casual contacts on that flight. In line with the Commonwealth measures, all travellers arriving in New South Wales who have been in South Africa, Lesotho, Botswana, Zimbabwe, Mozambique, Namibia, Eswatini and Malawi during the 14-day period before arriving in New South Wales must enter hotel quarantine for 14 days, whether or not they are vaccinated. All fully vaccinated travellers who have been in any other overseas country during the 14-day period before their arrival in New South Wales must travel directly to their place of residence or accommodation and isolate for 72 hours pending further health advice. Any unvaccinated arrivals must go directly for 14 days in hotel quarantine. It's critical that anyone who has already arrived in New South Wales who has been in any of the 8 African countries I mentioned within the previous 14 days must immediately get tested and isolate for 14 days and call New South Wales Health on that number 1800 943 553 for further advice. In this phase of the pandemic, the onus is on all of us to keep each other safe. And New South Wales Health strongly recommends wearing a mask indoor where physically distancing can't be assured. Be vigilant about the symptoms of COVID, and please get tested and isolate if you do get those, even the mildest of symptoms. There are lots of clinics available across the state in which to get tested. So thanks very much everyone for continuing to do your best to keep us all safe through getting vaccinated if you're eligible, getting your booster shots when they're due, which is 6 months after your last vaccine, and importantly coming forward for testing if you have even the mildest of symptoms, and keeping up those COVID safe behaviours, which include hand hygiene and not going out if you have even the mildest of symptoms, and getting tested at one of the many clinics. Thank you.